at the end of the nasolacrimal duct, we have valve of Hasner. We'll have valve of Hasner, which is here at the end of the lacrimal sac. It's very important to know valve of Hasner because we'll talk about it later in the nasolacrimal duct obstruction and pediatrics. Again, the same. Here we have the lacrimal gland. Here we have the canaliculus, the lacrimal sac, which is around 10, nasolacrimal duct, which is around 12 millimeters. Then at the end of the nasolacrimal duct, we have the valve of Hasner. So we'll start with the lacrimal glands. These are serous glands situated at the upper and outer angle of the orbit in a depression known as the fossa for the lacrimal gland, or the lacrimal fossa. Each gland is approximately the size and shape of an almond. It is composed of secretory epithelial cells. Anteriorly, the gland is divided into two parts, the upper orbital part and the lower palpebral part. So some of it in the orbit and some of it out of the orbit. The ducts of the lacrimal gland, which are about 12 in number, open in the fornix of the upper lid. The gland secretes tears composed of water, salts, lysozyme, which is a bactericidal enzyme. Then we have the accessory lacrimal gland. So the first one, which is the large one, it is the main lacrimal gland. Then we'll have the accessory lacrimal glands, which are very small glands of exactly the same structure of the lacrimal or the main lacrimal gland. So we have one large lacrimal gland and we have many small accessory lacrimal glands, and all of them secrete the same thing. The accessory lacrimal glands are glands of Krause situated within the stroma of the conjunctiva, mainly near the forehead. Then glands of Wolfram. So gland of Krause and glands of Wolfram are accessory lacrimal glands, which are the same as the lacrimal gland, which is the main lacrimal gland, but they are small. Then we have the lacrimal puncta, two small openings situated on a small elevation called lacrimal papilla, about 6 millimeters from the inner canthus on each lid margin. So we have two puncti, one in the upper lid and one in the lower lid. Then we have the lacrimal canaliculi. These are narrow tubular passages which lie one above the other, being separated by a small body, the caruncle. The two canaliculi may open separately in the lacrimal sac or may join to form a common canaliculus. Then we have the lacrimal sac. It is a cystic structure lined with columnar epithelium. It is situated in the lacrimal fossa, formed by the lacrimal bone and the frontal process of the maxilla. It is about 15 millimeter in length. It's around 10 actually. Most sources say it's around 10 millimeters. So the lacrimal sac is around 10 millimeter in length and 5 millimeter wide when distended. The portion of the of the sac above the opening of the canaliculi is known as the fundus. So the fundus is the upper part of the lacrimal sac. The sac is continuous with the nasolacrimal duct inferiorly. This is the surgical anatomy of the lacrimal sac. This is the orbicularis oculi, and this is the angular vein. If you remove the orbicularis, you will see the bone, and here is the ligament. If you remove the ligament, you will see the lacrimal sac, and these are the canaliculi. If you remove it, you will see the lacrimal fossa. Nasolacrimal duct is a membranous canal, approximately 2 centimeters long. It's around 12 actually. It's around 12 millimeters. يعني around 1.2 centimeter, extending from lower part of the sac to the inferior meatus of the nose. So this is very important to know that the nasolacrimal duct is open. It opens in the inferior meatus of the nose. The blood supply of the lacrimal gland, the arterial supply is by the lacrimal branch of the ophthalmic artery and infraorbital branch of the maxillary artery. The venous drainage, it is by the lacrimal vein, which opens into the superior ophthalmic vein. The lymphatic drainage تنتهي لل pre-auricular nodes. Eyelids, I'm not sure if you pass by this, the medial half goes to the submandibular lymph node. The temporal half, which is the lateral half, will go to the pre-auricular nodes. Nerve supply, we have the sensory nerve, lacrimal branch of the ophthalmic of the fifth, trigeminal. Then we have the sympathetic supply, carotid plexus of the cervical sympathetic. Then we have the secretomotor fibers. These are derived from the facial nerve via the sphenopalatine ganglion. Again, the photos are on the... Anyway, tear is a secretion from the lacrimal gland and the accessory lacrimal glands. Again, it is slightly alkaline and consists mainly of water, small quantities of salts such as sodium, chloride, sugar, urea, protein, and lysozyme, the bactericidal enzyme. The secretion of tear does not begin for 3 to 4 weeks after birth. The average normal secretion of tear is around 0.5 to 2.2 millimeters, and the normal pH of tear is around 7.5. The tear film is very important to know the composition. The outer layer is lipid, which is secreted by meibomian gland and Zeiss gland. So you should know this very well. The outer part is lipid, which is secreted by meibomian gland and Zeiss. Then the middle part is aqueous, which is secreted by the lacrimal gland and accessory lacrimal gland. The inner part, which is mucin, secreted by goblet cells. Then here we have corneal surface. So the outer part is lipid by meibomian Zeiss, aqueous lacrimal gland, and accessory lacrimal gland. The aqueous is the thickest part of the tear film, or most part of the tear film. Then inner part, we have the mucin, which is secreted by goblet cells. Okay, we just explained that. This is just photo for you. Here we have the eyelash. Then just inner to the eyelash, this is the opening of meibomian glands, which is lipid gland. The gland which secretes lipid. This is the lacrimal. This is the lacrimal glands. And this is the gland of Wolfram, the red one. The blue one is the gland of Krause. And both of them, gland of Wolfram and gland of Krause, both of them are accessory lacrimal gland. Then we have here the long one. This is the meibomian gland, and the yellow one, which is on the base of the lacrimal of the eyelash, is the gland of Zeiss. Gland of Zeiss and gland of meibomian gland, they both secrete the lipid part, of the tear. This is the meibomian glands. The dots here, droplets, these are the lipid. So this is lipid, this is lipid, this is lipid, this is lipid. These are the openings. And the openings. This is the opening of the lacrimal, the meibomian glands, and these are lipid. These secreted from here. So the functions of the surface of the eyeball must remain wet for comfort and normal functioning. The tear film spreads over the surface of corneal epithelium by gravity, capillary action, and blinking of the eyelids. It washes away irritating material such as dust. It contains protective substances such as lysozyme, immunoglobulin, then the bactericidal lysozyme prevents microbial infection. The oiliness of this mixed fluid delays evaporation and prevents drying of the conjunctiva and cornea. Normally, the rate of secretion of tears keeps pace with the rate of drainage. When a foreign body or other irritant enters the eye, the secretion of tears is greatly increased as the conjunctival vessels dilate. The secretion of tears is also increased in emotional stress state. This is the physiology of lacrimal drainage system. In A, you will have the tear film. Then you will blink, and it will pass to the canaliculi, then to the lacrimal sac. Then you just open your eyelids, and it will be pumped down. So this is very important. Acute dacryoadenitis. Acute dacryoadenitis, which is acute inflammation of the lacrimal gland. It can be infectious and non-infectious. It can be infectious or inflammatory. In infectious, it is occurring in association with mumps, influenza, infectious mononucleosis, etc. Sometimes leading to suppuration and fistula formation. Symptoms: there is marked pain, redness, and swelling in the upper and outer angle of the orbit, along with excessive watering of the eye. عندنا redness or swelling in the upper and outer angle of the orbit because this is the place where the lacrimal gland is. Signs: a tender swelling is present at the outer of the upper lid, spreading towards the temple and cheeks. There is congestion and chemosis of the conjunctiva and upper part. Pre-auricular glands may be enlarged and tender in the infectious type, not in the inflammatory. So the pre-auricular lymph nodes, which is pre-auricular glands, may be enlarged and tender in the infectious type. This is how it looks. The main problem is here, which is the place of the lacrimal gland. فيصل حربي.
دكتور وش معنى temple؟
temple.
نعم.
temple is the bone.
temporal bone يعني؟
temporal البون اللي في السكال bone. temporal.
تمام واضح.
So the complications of acute dacryoadenitis, Suppuration leads to abscess and fistula formation. There may be cystic degeneration and atrophy of the gland, resulting in dry eye. Differential diagnosis should be differentiated from lid abscess, stye, suppurative chalazion, acute purulent conjunctivitis, orbital cellulitis, and osteomyelitis of frontal bone. Treatment: hot compresses are applied several times a day. Systemic broad spectrum antibiotics are given in full doses. This is in and systemic anti-inflammatory like steroids given in the non-infectious. So as we mentioned, we have infectious and we have non-infectious. For the infectious, we can give broad-spectrum antibiotics. For the non-infectious, we can give anti-inflammatory like steroids. Then we can do incision and drainage in cases of abscess formation. Tumors of the lacrimal gland, we have benign and we have malignant tumors. The most common tumor, or the most common benign tumor, is the pleomorphic adenocarcinoma or mixed pleomorphic adenoma, which is the mixed tumor. The benign mixed tumor usually occurs in middle life. It presents as slowly progressive painless swelling in the upper lid. It may result in a mechanical ptosis. It should be excised. Malignant tumor, the malignant tumor presents with a short history of and pain. If malignant, radical surgical removal is necessary. This is very important. Dacryocystitis now. Dacryocystitis is the inflammation of the lacrimal sac. We just finished with the lacrimal gland. Now we'll talk about the lacrimal sac, inflammation of the lacrimal sac. We can have congenital dacryocystitis and we can have acquired dacryocystitis, which is maybe acute or chronic. Pediatric nasolacrimal duct obstruction, pediatric nasolacrimal duct obstruction and dacryocystitis. Inflammation of the lacrimal sac in the newborn may present as an acute or chronic process, which is dacryocystitis. The etiology of the dacryocystitis is the failure and canalization of the nasolacrimal duct. The lumen being blocked by epithelial debris. It may be a bilateral condition. The main problem. So the main problem here is the nasolacrimal duct obstruction. If you remember, valve of Hasner, the one I mentioned, valve of Hasner, which is at the end of the nasolacrimal duct. Here, it will not be patent in children. In some of the infants,